So hello, everybody. We're here with Jonathan Dropkin of the Work Injury Support Group at Mount Sinai Hospital in New York City. And I have been requested to do this topic. My doctor doesn't understand me and gave me bad advice. We'll have some time. If you have comments, you can drop them in the comment box, but I'm just going to start out and we'll see where we go here. So before I begin, I want to say that if any of my own personal doctors happen to watch this, I am not talking about you. I love you. Doctors have saved my life, literally and figuratively, and I have friends who are doctors. I've had clients who are doctors. I've had students who are doctors, and they've all been wonderful, caring people who do the best they can for their patients. So I'm not making some sweeping statements here about doctors in general, but it is a real problem when you can't find a doctor to diagnose RSI and treat it. And one of the two most common questions that I get are, what doctor should I see for RSI? And what job can I do when I can't use my hands anymore? So it's a real issue. It's a real problem. And let's just dive in here. I will tell you, according to Dr. Robert Markison, medical students only get a few hours of training in this area. I'm not even sure they get a full day on it. And so in order to thoroughly understand all the possible diagnoses of RSI, it would require far more training than most doctors receive. So many doctors are not prepared to diagnose and treat one of the leading occupational injuries in the industrialized world. And they have to understand things like carpal tunnel syndrome, de Quervain's disease, cubital tunnel, Cripps, all these different injuries if they're going to be treating this, and so that they don't confuse one set of symptoms with the wrong disease, because a lot of them can be close. You need someone who's really good at making the diagnosis. So the warning signs of RSI are very subtle in the beginning. They're weakness, fatigue, your hands just feel weird, you have numbness or tingling, your hands feel heavy, you can't snap your fingers, you've got difficulty turning pages or flipping an egg or something over in the pan, you can't twist doorknobs or faucets, your hands are always falling asleep, you wake up with wrist pain, you're lacking in coordination, you get tremors or involuntary movements, soreness, and mild to excruciating pain. And if you go in to the doctor and say, my hands, they just feel weird, I think you might get laughed out of the office, by saying they just don't feel right. I'm not sure that most doctors would really know to take this sort of things seriously. And they may not be aware of the stages of RSI. So in stage 1, you get a little pain and fatigue, but it resolves. Stage 2, it's recurrent, and it starts earlier in the workday, and you get night symptoms, and maybe you can resolve it in stage 3. It can be chronic. And that means you've just got RSI. So it's no fun at all. And it can lead to a lot of panic, because then you think, well, what am I going to do? Everything hurts my hands. How am I going to make a living? So anyway, when you see your doctor, it takes about 90 minutes to really do a thorough initial intake of a patient. And most doctors don't get that amount of time. So they're lucky sometimes you're lucky if you get 15 minutes with them. And furthermore, a lot of doctors don't want to deal with occupational injuries because a lot of times RSI is related to your occupation if you're using a computer or doing repetitive things with your hands. There's many occupations that can be affected by this. So if it's occupational, they don't want to deal with workers' comp. And let's see, here we go. Let me find my workers' comp. So the number one reason why doctors don't want to get involved with workers' compensation is it requires so much paperwork and time spent on non-clinical tasks. They're just getting a lot of paperwork. They have attorneys' conferences, they have to attend depositions and trials, in-person meetings, telephone calls to prove the case, and it can reduce their income and increase their stress. And believe me, doctors are under a lot of stress because of the medical records that they have to use. They're very complex. These computer programs are hard, and a lot of doctors have complained to me about them. So there's another reason too. It's workers' compensation often leads to delays in treatment. And that is really critical because you're not getting treated in the early stages if you're lucky enough to find a doctor who can diagnose you. And it's, what are you going to do? It's really difficult. Approval for treatment can take months, and meanwhile, the patient is getting worse and, more importantly, not getting the treatment. Some doctors avoid workers' compensation patients because they know about these delays and they can affect your recovery, and they fear that you will hold them responsible for a less than optimal outcome. And then there's reason number 7, and someday I'd like to actually do a live stream on all of the reasons that this attorney went into, because they're all so pertinent to everything that we're talking about here. Workers' compensation may pay less, considerably less than other insurance, and payments to doctors for workers' compensation patients can be delayed for months or years by insurance company investigations. So, doctors have to make a living too. They have big expenses. They've got medical malpractice. They've got to keep their office open. They've got to pay their employees and their helpers. And if they're not getting paid, can you imagine? I mean, nobody wants to work when they're going to get paid 2 or 3 years later, or even 2 or 3 months later. We have to get our money for what we do. So you can hardly blame doctors for not wanting to accept workers' compensation patients. And there can be other reasons why doctors don't want to treat you if you have RSI as well. It's chronic, and people relapse, and a lot of times they just don't get better. It's just relapse, re-injury, get a little better. And, it's so easy to re-injure your hands once you've had RSI, because the tissue is so weak and fragile. And it's just not one of these things where you do a miraculous surgery and they're all better and everybody's happy and they go away. RSI patients have it. It's a chronic thing. So this can be discouraging for both the patient and the doctor. Some doctors just really like, seeing more success. And, that's their choice. And on top of that, there's an enormous amount to know about the upper extremity. It's really complex. Let me go back to this, see if I can find it. Here we go. It's so many different things. These are only a few of the kinds of repetitive strain injury that you can have. Most people have more than one. I stopped counting myself. I have about 24, 26. And so it's really a complex thing. When Dr. Markison was in medical school, his mentor was a heart surgeon, and his mentor said to him, if you want complexity, study the hand. Specialize in the hand. And that's what Dr. Markison did. And he's had a long and successful career in this field, knows more about it than any doctor that I've met. And I'm lucky enough to have him as my mentor, but there are very few doctors who have that amount of expertise. And he told me that there's a diminishing number of doctors who show any interest in the hand. And again, you think about it, if the medical student is looking at specialties and maybe word of mouth around the medical school as well, if you treat repetitive strain injury or overuse or work injuries, you're going to get a lot of workers' comp claims, and those don't pay very well. So that may be one of the reasons, maybe people are not interested in the hand. So, there wouldn't be that many doctors who would study this. So what can go wrong if treatment is delayed? People can work through pain. Many people avoid seeing doctors because they can't take time off work, or they think their situation will resolve because, it resolved over the weekend last time. And then it's back, but it goes away. And so if they keep not getting treatment, it makes the injury worse, because now it's kind of like driving on a flat tire. Bad things can happen to your car. So sometimes what people do is they have an episode of pain, so they try to fix it on the outside with by self-splinting or taking vitamins or getting a massage or acupuncture or some other treatment. But this further delays diagnosis and treatment from a qualified medical doctor. And repetitive strain injury is episodic in the beginning, so it's not unusual for people to have an episode that goes away, and then a few months later, a few weeks later, another episode, and then another episode, and they start getting closer and closer together, and then they stop stopping, and you have the symptoms most of the time, and the symptoms could get worse. And by the time they get to see the doctor, they're usually in significant pain, which is the later stage of the injury. But I would like to say that just because you're not in pain doesn't mean the injury is gone. It could be, the tissue is still fragile. So it's great. I mean, basically your job is to stay out of pain, get out of pain, stay out of pain, and don't do things that are going to provoke a relapse. But the soft tissue is very fragile and prone to re-injury because of the scar tissue. It's much more easily re-injured than normal tissue. So what can you do? Educate yourself before you see your doctor. I have a playlist on my channel called What You Need to Know About Repetitive Strain Injury, and there's also some good ones under Ask Your Questions About Repetitive Strain Injury. This way, you're going to be ahead of the game, because you'll have a sense of, like if you watch the playlist on what doctors need to know, there's an episode by Dr. Markison about what is involved in a thorough RSI exam. So if you watch that episode and your doctor doesn't do any of those things, it tells you something. So then the other thing is you can educate your doctor if they're willing to be educated. I mean, maybe they're not interested in repetitive strain injury. Maybe they want to refer you to someone else. But if they are interested, I have a playlist on my channel, What Doctors Need to Know About Repetitive Strain Injury. There's also a playlist exclusively of Dr. Markison's episodes, which are all worthwhile. They're on my podcast. You can just listen to them when you're taking your walk. And then there's another one about Ask Your Questions. Why did I get RSI? That talks about the risk factors, and doctors may not know these things. So Dr. Markison is a professor at the University of California, San Francisco, which is an esteemed medical school, and he teaches other people about hand injuries. He gives this very comprehensive talk about diagnosing an RSI, and I really recommend that you watch it before you see a doctor. And if your doctor is interested in learning, they can watch it too. So how do you find a good doctor? This, the knowledge, it's not the specialty so much as the knowledge of the practitioner. So physical medicine doctors, physiatrists, osteopaths, occupational medicine physicians can be very good choices. And especially these, the osteopaths are less likely to want to prescribe heavy drugs, which is really good news in many ways, So if you can get those, they tend to know more about soft tissue and can be helpful in that way. But, I can't say blanketly go see your osteopath because some of them are just like allopaths. They do the same thing. They prescribe drugs and surgery the same way the Western doctors do. And by the way, osteopathy, a doctor of osteopathy is the same credentialing. It's covered by insurance. It's a bona fide doctor. They're just in a different, they have a different degree. So the other possibility is if you can find a surgeon who's not immediately going to suggest surgery and are happy to give you non-surgical treatments unless they absolutely have to operate, or you're going to lose the nerve or something. And in that case, I would get a second opinion. But most of the time, many times, there is no surgical remedy for repetitive strain injury. And it's so funny because people will say, well, why don't you get the surgery? Because they might get tired of hearing you complain about how bad your hands are. And the thing of it is, there isn't surgery for a lot of this. It's a soft tissue problem. So what are signs of a good doctor? They take your symptoms seriously. One of the patients, when I was sitting in with one of the doctors that I sat in with, some patient said, one of his doctors told him that if he was aware of a body part, it was a sign that his body was trying to talk to him. It was something to pay attention to. Because if everything's working fine, you don't hear those funny noises. It's like driving your car. If it starts making funny noises, don't you get a little concerned? Don't you wonder, like, hey, what's going on? Why is my car going? Why is my steering wheel sticking? You pay attention to these things. So the other sign is if they put their hands on you, if they give you these tests, if they that test you and have you look around and take your pulse and with your arm up, and all of these tests are valid clinical diagnoses. You don't have to go running off. I mean, a lot of people get, x-rays. Well, x-rays don't, they're really not helpful. They're good for broken bones, but they're not revelatory in terms of soft tissue. So anyway, it's a good sign if a doctor actually touches you, feels you, tests you. If their hands, like some of the osteopaths in the old days used to do this thing with the Bible. They would take a human hair and lay it between the thin pages of a Bible, and they would train their hands to feel that hair progressively over more and more sheets of pages. So they keep turning the page so that they would have exquisitely sensitive hands. And I can tell, I've been to a lot of doctors, and it's really interesting. Some of them zero in, they know exactly where they're going, they know their anatomy, and it's a wonderful thing. And there's also that sense of connection with your doctor, that's missing. Dr. Pasquarelli was always saying, these new doctors are always putting a machine between themselves and the patient. Let's talk about healing, the doctor-patient relationship. And so these clinical diagnoses do more than just give the doctor feedback. It's also a sense of connecting with a trusted physician, someone you hope to have a good relationship with. Okay, then the other good sign is they understand the relationship between the activities that you do all day and your injury. So if you're using a computer all day and your doctor says there's no relationship between using a computer and injury, it's a big red flag that they don't understand biomechanics or overuse injuries or many things that they need to understand to really treat you. They also, if they look at your posture, when I was at the Miller Institute, the patients would be gowned, which is kind of unusual. And we would look at their shoulder blades, their neck, do tests to test the range of motion, their posture. Do they have a forward head? Are they able to maintain good posture? All of these things give you enormous information because most RSI basically starts in the neck because there's just a whole domino effect that I'm not going to get into right now, but they really need to look at your neck. And if the doctor says, I'm sorry, we only look up to the elbow, or we only look at the wrist, the hand is the fingertip to the shoulder blade, and it includes the neck. So they need to do all of that. And then they need to be knowledgeable about the many different manifestations of repetitive strain injury and understand how to distinguish between them to ensure an accurate diagnosis. Because otherwise, you can have an unnecessary carpal tunnel release because your doctor didn't know how to distinguish between de Quervain's disease and carpal tunnel syndrome. And that's happened. So your doctor can diagnose you, write a prescription for physical therapy or occupational therapy, and write you notes. How long can you be working? Do you need time off? Do you need special equipment? Doctor's notes are gold, and I suggest that you tell your doctor what you need. Tell them if you need special accommodation, a better chair, a keyboard tray. Write that note yourself and then hand it to your doctor. It will save him or her time, and it could help you with ergonomics, but bear in mind, ergonomics is not a cure. It has value, but it's limited because it doesn't take into account poor posture, overuse, poor technique, deadlines, all the things that can give you a really bad case of RSI, and it won't take away your pain. A lot of people say, well, I got my new keyboard, and their employers are saying, well, I got you a new chair and keyboard. What's the problem? You're still in pain. It's not a cure for pain. So, you're still continuing the offensive activity, the offending activity, and that's the dilemma. I mean, the time for really good ergonomics is before you ever sit down to a computer. And what I recommend is people get the best ergonomic setup they can and use it as little as possible, because it's the overuse, it's the poor technique and the overuse, and you use your hands for everything else during the day. Okay, so here are some red flags of things that you don't want to see in a doctor. Someone who doesn't listen to you or isn't open to your ideas, or you're basically telling your story. A lot of doctors will not know proper treatments, and they can write a prescription for a non-steroidal anti-inflammatory, which can be really bad for your stomach. They need to be done very judiciously. I have personally never taken any of the heavy drugs myself because I didn't want to mask the pain. The pain is there to tell you something. You're doing too much. It's kind of your friend in that way. And they can also give you splints. And the problem with splints is, they might be helpful at night if you've got carpal tunnel syndrome and you need to keep from flexing and kinking your nerve because you're sleeping like this. So at night, a nice comfortable splint might be advisable, but I see people working with them on, and that can really lead to some disasters, as Dr. Pasquarelli was saying. I've seen disasters with splints. Because you're working against the splint, it can lead to muscle atrophy, lack of fluid return, dependency on the splint. So, it's just, it can make matters worse. And it doesn't get to the core of the problem, which is what needs to be addressed. So another thing that you want to watch out for is somebody who tells you that your symptoms are all in your head and see a psychiatrist. You might want to see a psychologist because people get so freaked out about dealing with RSI, and it gives you someone to talk to and have a sympathetic ear, and that can be really helpful. But it's not all in your head. If the doctor doesn't perform hands-on clinical diagnostic tests, I wonder if they know them. If they don't look at the entire upper extremity from fingertip to shoulder blade, I wonder what they know about RSI. If they immediately prescribe pain meds and splints without following you carefully and saying, let me know how it goes. You're just going to be on this for a bit. Use the splints at night. Be careful. Tell me how you're feeling. I'm following up with you. And they don't understand the relationship between activities such as computer use and repetitive strain injury. Those are red flags. So the other thing that's really important is that, and I've never seen anybody but Dr. Pasquarelli do this, and I do the same thing when I'm doing ergonomic evaluations. He had a little mini workstation set up, and there was a camera, and he had us the patients would sit down, and he'd say, okay, set up your workstation the way you have it at work, mimicking the setup, the angles and everything. So where was their keyboard? Where was their monitor? And then he would say, okay, type a little bit, and he'd film them, and then they would rewind the film, and Dr. Pasquarelli would go with them and say, here's why you're having this pain in your elbow. You're ulnar deviating, you're pointing your pinky. And I do the same thing. When I'm doing ergonomic evaluations, I look at people's technique, and you wouldn't believe how grateful people are to just learn, like if they just make this minor adjustment to either the setup or the way they're holding their hands. This is really key. I have so many tricks that I use myself. I teach them to my clients. It's really helpful because we still, even if we have RSI, we still have to use computers. We still have to use our hands. We still have to use our phones. I show people how to use their phones more safely. This is really critical, and it's missing in most medical situations. So once my students learn more neutral ways of computer technique, their pain recedes unless they're on deadline and they revert back to their old habits, and then the pain just shoots back. So it's a really important part of the equation. And good technique is important in everything from using a keyboard to opening a door to pressing an elevator button, using your cell phone. And I have tricks for all of those things. It's kind of funny sometimes. But the thing of it is, this is self-care. Good self-care and self-use, how you use your body, how you use your hands on a daily basis, are one of the best ways to attain and maintain more functional hand use with exercise, because you are avoiding inflicting further unconscious, unwitting damage on yourself. People have no idea. Too much force, the wrong angle. All of these things can be avoided with, a lot of these things can be avoided with good technique. Some of them, it's the tool's fault, and we'll get to that. Okay, so you need to tell your doctor what you need. You need physical therapy. So then you need to find a good physical therapist. And if you can't find a good doctor, find a great physical therapist. They are very well trained in upper extremity issues. They frequently know more about RSI than doctors really, and they're helping you get better by performing manual therapy, correcting poor posture by strengthening and lengthening the appropriate muscle groups, giving you the right exercise program. All of these things can be really helpful. But when you're looking, and by the way, I just posted this video. Oh, where is it? Here. If you look for this video on my channel, it's recent. It tells you a lot more than I can go into right now about getting a good physical therapist. Because just because someone else raves about their doctor or PT or the treatment method doesn't mean it's going to be right for you. Everybody's different. So trust your instincts and figure out what's actually working for you and helping you. The bottom line is, are you getting better? Is your therapist adjusting the treatment if it's too much for you? Are they checking in with you saying, how's the pressure? Is this too much? How do you feel? How did you feel after last session? How are the exercises going? Do they respect your limits? And in terms of exercise, the right exercise can be brilliant. The wrong one can set you back. So I've had a lot of experience. Sometimes I feel like I've been to every physical therapist in New York City. And I was bruised by one. They found a thumbprint on my neck. One of them dismissed my symptoms as, you know, they had this new fancy machine that's supposed to cure everything. And I found that I was holding this little sample can of paint, and it wasn't heavy. I wasn't holding it for very long, just to go to the checkout counter, and I could feel my thumb being strained, and that was the area that they were working on. And you know, the next day, I noticed that my thumb was bruised and swollen, and so I told the physical therapist, you know, just FYI, I was bruised, and she says, well, maybe it was holding that can of paint. But they had built this as this big curative thing. So why, if it's curative, why would I have this, you know, immediately after the session, have this symptom? And sometimes I feel that if the treatment doesn't work, the doctor or the PT or the other helper could blame you for not getting better because you're not responding to their treatment. And, you know, I understand they want to do their best. They want you to get better. But sometimes you need to switch to other modalities. Sometimes the modality that they used just wasn't right for you. So it's good to, you know, say, can we do something else? And sometimes, you know, I'll have a physical therapist who say, let's try a little of this today. And it was brilliant. So they incorporated it into my regular maintenance program because it works for me. So having that relationship with a good physical therapist is a lifesaver, and they can really help you if, you know, if they're good. So this is advice that nobody wants to hear. Keep looking, keep struggling, keep trying. It can feel really discouraging. You know, this guy's climbing up a sheer rock face here because, you know, it can take many people before you find somebody who actually knows what they're doing and set up your team, because you need a team. You need the doctor, the physical therapist, you know, other people that are going to help you, and the complementary people. Maybe you've got a great acupuncturist or, you know, some other treatment that you have. So the thing is that repetitive strain injury is chronic, and it means you need regular treatment just to maintain your progress. You can also have flare-ups and re-injuries, and this can be discouraging not only for you, but also for your doctors and PTs. So everybody needs to be patient. And the other thing I wanted to say is when you're visiting your doctor, sometimes it's worth it to bring a friend, because it gives you a different perspective. I've had a couple of interesting experiences with this. One time I had a workers' compensation doctor evaluate me. It was one of those independent medical things where they're basically trying to, see if you're malingering or whatever. And I took a male friend because I didn't want to go to that appointment by myself. And the doctor was much more interested in my male friend than he was in me. And fortunately for me, my friend had the same last name as a famous American general. So that impressed the doctor. I know, it's funny. And so that kind of helped me. My friend, who has very good judgment about doctors because he's been to lots of them, did not like this medical examiner. And I took the same friend when I needed some surgery for something. And I thought the doctor, he seemed a little businesslike to me, and I wasn't quite sure about him. And when we left, my friend said, "Oh, no, he's really good." And later on, I realized just how right my friend was. He was spot on. This doctor, I noticed as I got to know him, he wore these ties with little teddy bears on them. And I thought one of his patients gave him those ties to reassure the person who's panicking because they're going to have some surgery. And I thought that was the sweetest thing. It's sort of a subliminal hint like, hey, I know you're scared. Here's a teddy bear. I mean, it was just a really sweet thing for him to do. But anyway, he was one of the most compassionate doctors I've ever had. But I found that it's helpful sometimes to bring a friend so you have another opinion and a little moral support too. So, all right. So now the big question is, why are we in this pickle? Why aren't more doctors trained in the leading occupational injury almost? There's only so much you can do individually. And furthermore, all of the responsibility should not be on the patient. We need comprehensive legislation for people with RSI. We need bills that say people need education about RSI. Doctors need to be trained in this, and they need to be compensated for this, compensated well, just like they would be for any other disease. So thank you, Alexandria. So sign the petition to end RSI on change.org. It's all laid out there. I'm not going to go on and on about the petition because I did that last time. But I think if people rose up, something could happen. And look at that. That's a curb cut. The curb cuts happened because some kid who went to UC Berkeley, and he was in a wheelchair for some reason. Let me see if I can find his name. Jack Fisher, a Navy veteran and lawyer, lobbied for the nation's first curb cuts in Kalamazoo, Michigan in 1945. And then this guy, Ed Roberts, contracted polio at age 14, was paralyzed most of his life below the neck. He was the first student to attend UC Berkeley. And apparently he was responsible. This is good. Roberts and other Berkeley students with disabilities took matters into their own hands with regard to Berkeley's inaccessible sidewalks and street corners. They demolished curbs and laid asphalt at night to create curb cuts, all while demanding that the federal government pass legislation to eliminate barriers to access for Americans with disability. Well then, so, these things don't happen by themselves. We need to fight back. You need to complain to your congressman. You can send your congressman that petition. Demand that the government do better by injured workers. Demand that manufacturers fully test tools for hand safety before they unleash them to a public that is forced to use them. We don't have a choice. We have keyboards and mice. Or, if you're lucky, you have to buy the dictation, but you still need the keyboard and the mouse. So change doesn't happen quickly or easily. Think of how long it took before climate change was taken seriously. We're having bad weather, floods, fires. Before there were curb cuts and ramps for people who use wheelchairs, there weren't as many, before those actions were taken, there weren't curb cuts or ramps for people who use wheelchairs. There weren't as many accommodations for blind people. There are Braille on those elevator buttons. That was mandated. And deaf people are entitled to American Sign Language. Oh, I guess the video doesn't work. Sorry. I had some people signing. So even some New York City Police Department officers are learning how to sign because, you need to communicate. When you're voting, there's accommodation for disabilities in the United States. And some of these changes came about because of the Americans with Disabilities Act. None of these changes happened easily, and they happened because of grassroots efforts from people like you and me who worked for it. So if you're feeling frustrated, angry, or depressed, take those feelings and put them into action. That will effect change for everybody. We can do the same thing for people with RSI. In the Netherlands, they're right on top of things. They translated my second book into Dutch, and apparently, according to a website that I went to, there's a number you can call to get a coach if you have RSI. They will be provided to you. The United States could do the same thing if we had the will. So please sign the petition, have your friends sign if you haven't already. I have downloaded this is a little flyer that you can carry with you. I have one that I carry in my purse, and people can just click on the QR code and download the thing. And I had this fantasy of getting a group of people with RSI together and going to Times Square and setting up a card table with this little sign and just talking about RSI to all the people who are going through the crossroads of the world, trying to get some attention to this issue. So if anybody's got any bright ideas or wants to join, let me know. The other thing I want to say is I have a membership on my channel. You can join, support the work that I'm trying to do here. So that's it for me. And my gosh, we've got some comments. So let's see who's saying what. Red flags. So Moving Pictures was talking about red flags. I'm not sure what they were intending there, but yes, there are red flags with doctors. So do either of you have anything you want to add? You're muted. Unmute your mic, Alexandria. And you too, Jonathan.
There we go. Thank you for catching that. The one thing I wanted to mention was with WorkSafe or workers' compensation, sorry, is you often have to fight, and that is a long and drawn out process. It's not even just waiting for the first letter from them. And sorry, let me back up. I apologize. It took me years, and I had to take matters into my own hand because workers' compensation was dragging their feet in even just initially getting back to me. And I was just so wounded and so in so much pain. And thankfully, I did take matters into my own hands and found your book and you, and that was all great. But what happened with workers' compensation, of course, is they denied my claim, and I had to go back. And then I'd get an inch, and then they'd say no. And it was this constant back and forth. It was years before it finally got accepted. And I went into so much debt because of all the treatments I was pursuing and because I didn't know what to do. As you know, back then, 26 years ago, there wasn't a heck of a lot of information. Um, so I don't want to frighten people, but be prepared for the possibility of having a bit of a fight, and you're not alone. It's
Yeah.
okay. You just have to keep at it. The best thing I feel, as you've mentioned, you can do is take your own recovery into your own hands. Find the supports. I
Yeah,
think
but you
that's,
have to pay out of pocket. I mean,
I
we're
know.
all going broke because we're not working, and then you got to pay out of pocket. And then the other thing that's so disturbing is that workers' comp treats people like criminals sometimes. I
Oh,
mean, they're
they
following
do.
around with cameras saying, "Well, you could do this. Why can't you do that?" And
Yeah.
um, it's just not a good system for anybody.
No,
Everybody
no,
hates it.
I agree. It's an absolutely broken system. And yeah, I mean, it's some people can't even go into debt, right? They don't have, and that's where, like you said, sign the petition. Everyone, please sign the petition.
Yeah,
There we go. And if it ever comes to it, I would happily join you in New York and
I
educate.
know. Wouldn't that be fun?
That
I
would
think
be
it'd be
fun.
fun to get a bunch of people.
Yeah. Sorry, I'm done.
Okay, we got somebody. Tendonitis in your left hand. Yes.
Uh,
Yeah. Well, 4748 times. It's hard. Tendonitis is painful, and I hope you have a good doctor to help you get through that. I'm sorry to hear
just don't.
that.
I know. Just don't overcompensate with your right. It's
Yeah.
it,
Yeah. Good.
that's the other thing.
Yeah.
um, I'm sorry to hear you say that.
Yeah. Jonathan, you have anything you want to chime in?
Yeah, I just wanted to get back to someone who commented about red flags. One is 50% of the battle is you have to find a provider, either a physician or a physical therapist or both, that's compassionate and empathetic. Because if they're not, it's going to absolutely, it's already an uphill battle. It will be more of an uphill battle. So those two issues, you just have to sort of, you have to find someone once again with with compassion and empathy. And in terms of another red flag, the red flag would be if they don't have that. Another red flag would be if you're getting worse, you should not be getting worse with any treatment. So Deborah talked about after she left a PT and the next day she had a bruise and the PT blamed her. I hear that all the time with my patients. You should not be getting worse. There might be no improvement with a PT or a physician or an OT, but you should absolutely not be getting worse. Okay, so that's also a red flag. In the beginning, lastly, Deborah talked about overexertion. So if you're really inflamed and symptomatic and you have a ton of pain, you do not want the therapist, PT, or OT to give you strengthening exercises,
Yes.
right? Okay. You could, Deborah, you could go into that,
Oh
but that's
God. I
overexertion.
have a whole episode on that,
Yeah, yeah,
Jonathan.
yeah.
So that's, if they find out you're weak, then they start giving you wrist curls, which totally just is weakening already weak tissue. Getting back to the person with tendonitis, if you can stop using it and get yourself into some good PT and rest, um, that will really help, reduce that inflammation and get some good advice because you have a little tendonitis in your left hand, and then you can have compensatory and substitution injuries. And get some treatment, please. And good luck. I hope you find someone wonderful. And then, Jonathan, I hope I didn't interrupt you, but do you want to talk about the IMEs?
I really don't know much about them except, so your advice of bringing someone once again, I hear it time after time. If I don't bring someone, I get abused. IMEs stand for independent medical exams, and they're usually not your physician. Well, they're not your physician. They're the insurance physician, and they're on the insurance company side, and they don't want to pay for imaging, for diagnostic tests, or for treatment. So if you don't bring them, I hear it a lot from my patients that the IMEs were indifferent, or worse, they were abusive. And if you do bring someone like Deborah brought, it's an entirely different picture on how the physician approaches you. So I also, maybe you could check if you're allowed to bring a friend to an IME.
I didn't ask. I just did it.
Okay.
I mean, I think
I recommend it 100% of the time then.
Why wouldn't you? I mean, it's like.
Yeah. No, I agree. Yeah.
And it was like Alexandria was saying that, we have to be proactive about, sticking up for ourselves and it's terrible. I mean, people who get injured, they're motivated, they're doing their jobs. They just didn't know. They had a lousy workstation. They worked too much. They were the person who was putting in the extra time to help out somebody else who had to go home for childcare or something. These are the people who work overtime. A lot of them are just really good employees, and nobody deserves RSI. So anyway, we've got, I've written to my Congress people about how horrible. Oh, let's put Cam up. Hang on. Cam, I have written to my Congress people about how horrible state insurance fund is. They still 25 do surprise gotcha visits. Well, see why, this just is so disrespectful. And, as I said, the most common question that I get, sorry, I'm getting heated here, but is what job can I do now that I can't use my hands? And good luck, even if you find an employer, so often you can't do the job. You can't keep up with the other people, even if they say, oh, don't worry, we'll take care of you. You can take breaks. It doesn't work out that way, usually. So the best thing you can do is get to a point where you can fix yourself up and become an entrepreneur and work for yourself, because then you can really take care of yourself. You set your schedule. You take breaks. You have to take the afternoon off. You can do that. You can rest your hands. So I'm sorry to hear that they're making. What state does Cami live in? What state is that? Tell us. So Moving Pictures says, bring someone to video the IME visit. Oh, you're allowed to bring someone and record. That's a good idea. I have found that the times that I've been examined by an IME doctor, they're not that knowledgeable about
NYC.
Oh, well, yeah. Okay, we've got another one. Let's see. She's in NYC. Yeah.
Wow.
Yeah, I think we need to do an episode for people on these issues, because it's horrible. But I mean, basically, I think we really need to have a better system to replace workers' compensation, because if you're cheating, if you're playing the system, I don't think you get that much money. I mean, the people that I deal with very often have had really good jobs, highly paid jobs, and workers' comp doesn't cover their rent. Yeah, say it, Jonathan, because you probably know.
Yeah, I don't know what the percentage is, but I reckon it's poverty. Everyone struggles. Rent, food, transportation, everyone struggles. Again, I wish I knew what percentage you get, but I don't. But it's it's absolutely a financial heartache for everybody. The two of you can testify to that, correct?
Oh yeah, for
Yeah,
Totally.
sure.
yeah. It's not pretty. You
No.
don't want this.
No, I mean, your career gets derailed. I mean, the thing that you love to do is suddenly not available to you anymore, so you have to recreate yourself. And it can, I think it can lead people to good places. It's not like it has to be the end of the world, but for many people, it can be incredibly um, uh, uh, depressing.
Oh my gosh, totally. It's so sad. And yeah, I mean, that's a whole other episode unto itself. But
Yeah.
yeah, it's funny. I don't understand either how there's this belief that we're all trying to cheat the system, and for what? No one wakes up and says, "This is a good way to cheat the system." No, no,
Yeah. I
it's
mean, you'd have to
ludicrous.
you'd have to clone into like 25 different people to make any kind of money.
I
Like
know.
you'd have to have your false IDs and then go in with, and you'd have to get a doctor to sign. I mean, it just would be.
It's and that's the thing. They feel, and they, as in workers' compensation, feel as though everyone wants a piece of their pie, and it's like, no, you have nothing
You know
of
what?
substance to offer.
Revisit. I did a live stream with a really great attorney. It's the top of my list. He did it on workers' comp, and he explained how the insurance companies make money
Uh-huh.
by denying claims and stuff. It's very interesting. So you should, if you're interested in that issue, it's
Is
there.
that in Canada, they get a bonus for everyone that they refuse. So I'm not sure if, anyway, I should probably not speak to that. But anyway,
Well, it's an international issue. I mean, I
yeah.
think you know we have people from Canada who are looking at this channel, so it definitely is relevant, and I think it's good. It's a problem in the industrialized world. We need
Mm.
to um, take take this. Okay, so let's show
Oh,
this.
here we go.
Fraud rate among injured workers is not more than 2 to 3% among employers and insurance carriers. Much higher. Yeah, that's for.
You usually make more. I mean, I shouldn't say that, but when I was on insurance disability, I got a little bit more than workers' compensation was just dreadful. But
Yeah.
yeah, still.
And if
So,
you're working for an employer, you can't get um, you can't get private insurance. You can't use your private insurance. I mean, executives would say, no, 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 I can't do comp, but they find out eventually because of the injury. They know the insurance company says, oh, all these hand injuries, that's comp. So they shift you over to comp whether you like it or not, and it's very disturbing. It's very depressing. You have to go to these horrible. Um, they're not even courtrooms; they're hearing rooms. Usually in some far-flung place. You have to take. They make them as depressing as possible. I think, sort of like the criminal justice system. Um, Sorry, I shouldn't be complaining, but it's really an awful system.
oh, it is. It's terrible.
So we have something else. Let's see. Congressional hearing on health insurance. The doctor said she got rewarded for rejecting cases.
Yeah.
Yeah, that sounds about right. And I would like to say something else on that topic. When doctors say that there's no studies that show that computer use is related to repetitive strain injury, I'm thinking to myself, how convenient. It's kind of like,
Conspiratorial.
well, if you don't look at the problem, there is no problem. If you deny the problem,
That's
what
right.
problem?
Well, that's
We
just
don't
it.
have any evidence of this.
Exactly. As soon as
It's
there's a statistic, then that's it.
Yeah,
So
which is why, if anybody out there knows of any grants available, we would like to do a study. So, hello, we're putting it out there. Um, this needs to be studied, and it needs to be studied in real life terms. I'm talking about what happens to people after they're injured. You know, it's a long-term prospect. People have to reinvent themselves. It doesn't go away. They have to deal with depression and relapses and all these other things. And I have found through observation over 3 decades that RSI tends to get worse every year among people because you can't stop using your hands. The injury doesn't go away. It doesn't stop. One of the doctors that I used to see said it's like trying to stop a freight train. That was a doctor talking about trying to stop RSI, stop the cumulative nature. And I don't want to sound alarmist, but if people knew the truth, usually they don't find out the truth of the situation until they get the injury. And, you know, it's better to know. But the other thing I'd like to say is this is a preventable disability. Why aren't we doing something? You know, it's preventable. Studies are expensive. Will Sinai sponsor a study? I'll let you answer that, John.
Sinai won't sponsor a study per se. It's basically you have to write a grant. So grants could either be federal, they could be state, New York State Department of Health, Department of Labor, or a local, a county. So you would have to sort of, or I would have to write a grant, an ergonomic grant, and do a study on probably an intervention, because we already know that computer use is associated with these problems. So it would basically be an intervention study. But yeah, it's a great question. But yeah, again, Sinai won't do it per se. They would support me getting a grant, and I've written a lot of proposals, but they just don't get funded. Federal and state proposals, but they just don't get funded for whatever the reason is, and I could go into that. Yeah. Yeah, one of the people in the support group just emailed me. She's having trouble writing in the chat to everybody, but she just said Dr. Pelichian was interested in doing a study. He's at Northwell now, but I don't know if he actually, again, you need a money to do studies, and I don't know if he has a grant or if he's doing a study. It's hard to do a study that's not funded.
Yeah, and you know, some of the studies that I see don't really apply to what I think is really important, what really needs to be understood, you know, like the long-term effects. It's like long COVID or something. I think we really need to do a study that talks about things in real life terms. You know, some of the studies are so theoretical. I just wonder, you know, like why, I don't know. All right, so we've got another one. So many things you're saying, Deborah, right? Yes, thank you. Appreciate that. It's nice, you know, we do have a nice community, and I think that I hope that people will rise up. You know, I've been studying various, you know, I'm always fascinated with the person who never dreamed they'd be leading a march or, you know, founding a foundation to prevent, you know, drunk driving or school shootings or something like that. But they feel, you know, like it has to be done. And I believe that the grassroots demand actually makes change. And we have pocketbooks, we have votes. I just hope that, you know, that's why I did the petition, because I want millions of signatures. I want people to be able to go say, hey, look how many signatures are on this. Why don't you do something? So I appreciate that. So is there anything else that we want to talk about until next time? And if you have ideas of live streams you'd like to talk about, I'd like to get that lawyer on talking about the reasons why doctors hate workers' compensation. There's so many topics that we could address here. So if you have any bright ideas, you can drop them in the comments below. You know, share this with people if you find it useful. And I'd like to thank Jonathan and Laura Miner for inviting me to come today. And Jonathan is in charge of, I think, do you want to give how do people, if they want to join your group, how do they do that, Jonathan?
Oh, they could just email me. Deborah, is there any way you can write my email and
I'm on it.
Yeah.
Okay.
Can you relay it to me? Or
yeah.
Deborah.
But the one thing I wanted to mention is that Deborah and I were talking before the session started, and we'd like to actually have another session, maybe in early fall, regarding the RSI community. I actually call these work-related musculoskeletal disorders, but it's international, and we were thinking maybe Deborah can host. Probably early fall would be nice, sort of an international, one of these sessions, but international. So from Holland, from Israel, and the West Coast. We already have Alexandria from Canada. So maybe we can coordinate that with Deborah's contacts overseas and in California, coupled with the New York group. And we could sort of all jam and talk about almost like a free-for-all in terms of maybe solutions, how to sort of day-to-day ways to sort of how to get through a day. Actually, any topics anyone wants. So, Deborah, you want to talk more about that?
Yeah, I mean, it's hard for me. I've contacted some of these people and they don't get back to me, but definitely that's on my list. And I'd like to say thank you, Bestie, for that super chat. That's so sweet. Thank you means the world to me. Oh my God. And Mark Miller, let me get you up here. Thank you, Mark, for attending. Yeah, I know. Which of my books did you read? The first or the second? Could have been the second. Which I just looked over and I thought, it's really still pertinent. Some of this stuff, I don't like the ergonomic stuff I used to do, but thank you for that super sticker. You know what? That's my very first super sticker. So you get the prize. You're the first, you're number one, Bestie. I love that name. Bestie FSW Lady. Okay, London has done international. Yeah, well, if anybody, if you have contacts and want to put them in contact with me and tell them that we'd like to have that, just drop, the comment. Tell Jonathan. Did we put Jonathan up? Did we put his?
No, I don't have. Oh, I do have his email address. I'm sorry. I just realized.
Oh, the Repetitive Strain Injury Recovery book. That's my book. Thank you. Oh my God. That's still available. The other one's out of print. Although I think somebody's bootlegging it because I still see people buying copies and I don't have the time, the energy, or the money to pay a lawyer to find out who's bootlegging my book. And so London, England has done international something, probably meetings, but I'd like to do it for us. So,
oops. Hang on. And I'm just going to put up Jonathan's email
Dropkin at mmssm.edu. So if you want to join the group, contact Jonathan. I think we have people from other places, not just New York, right, Jonathan?
Yeah, we have people sort of scattered about the country, but no one really, except for Alexandria, no one really international. At Australia, they have a robust body of literature. People do look at this problem.
Mhm.
What you're calling RSI, I'm calling work-related musculoskeletal disorders. But yeah, I don't have many people in Australia either. So
Yeah.
just anywhere who would be interested, that would be
Well,
great.
there's a whole bunch of people in the Philippines who signed my petition.
Oh, I didn't know
There's
that.
like 50, yeah. So I don't know if they're organized or not, but it would be interesting to just sort of see what's up. But anyway, it looks like everybody's kind of getting ready for dinner or going out or whatever. So I think it's okay to end now. I'd like to say goodbye, my lovelies. Thank you all for coming.
Thank you.
Appreciate. Yes.
Thank you. This was great.
Yeah.
Really, both of you, Alexandria and Deborah, thank you both. The whole group just is so appreciative of your expertise and knowledge.
Yes. Well, we're happy to do it. Oh
Yeah.
my God.
Happy birthday.
Thank you.
Holy cow.
Yeah.
Sorry.
Just keep coming. Don't sneak up on me. All right. Well,
Okay.
on that note, I think we'll
Yeah.
we'll end.
Okay. Thank
Okay.
you.
All right.
Thanks.
Thank you.
Bye.
Bye.
If I can get my cursor to work. Well, there we go.